Often when a child requires surgery, it can be harder for the parent than the patient. Thank you for joining us today for Live Healthy. I'm your host, Lauren Collar. We're at Somerville Medical Center today with Dr. Sam Suter. We're talking about pediatric surgery. Where's the process, Dr. Suter? Where does it begin for a child that requires surgery?
Well, typically patients are referred to us by their primary care physician, their pediatrician or their family practice doctor, and those patients are sent to us and referred to us, and we see them within a few days of that referral and then begin to talk to the parents about what the problem is and how we as pediatric surgeons might be able to help them.
So we know the child is having the surgery, but are there tips for the parents to get themselves and the child prepared?
Sure. I think it's worthwhile for the parents to come prepared to the appointment, learn what they can from the internet, gently, reading carefully, and then also, of course, from their primary care physician about what they might expect in our office. But of course, our role is really to tell those parents exactly what they can expect, both in terms of what the diagnosis is and how we intend to fix it. And so I think that's important. They need to come prepared, but we will fill in the gaps. And we'll also fill in the gaps with the kids. So that's part of our responsibility is to chat with these kids, the older ones, and explain to them what's happening in language they can understand about what they can expect that day.
What about the anesthesia aspect of surgery with children?
Well, it's funny you mentioned that. We do spend a lot of time in the office talking about the risks, the benefits, and the alternatives of the surgery and why the child's going to benefit from the surgery. But almost every parent that I've met in 20 years will then turn almost immediately to anesthesia and think, goodness, what, Dr. Suter, is the anesthesia going to do to my child? And the answer is anesthesia has some risks, of course, but the risks are tiny. And I often tell parents that you've taken bigger risks driving your kids off to errands or to grandma's house, and certainly on rainy nights or with other drivers on the road, than you will going to the operating room that day. So really, really manageable risks, and with our anesthesiologists, very, very small risks.
All right, well, thank you, Dr. Suter, for joining us, and thank you for being here for Live Healthy.
Live Healthy is sponsored by Trident and Somerville Medical Centers and provided as a service to you and your family.